that we are in a very different situation than we were early this year for three reasons. First and foremost, as Dr. Fauci just showed, our vaccines work. Fully vaccinated individuals have a high degree of protection against severe illness, hospitalization, and death. While we will see some cases among those who are vaccinated, as to be expected with any vaccine, these cases are generally mild and oftentimes asymptomatic, which is just more proof that the vaccines work. In fact, unvaccinated individuals account for virtually all, 97%, of the COVID hospitalizations and deaths in the U.S. Second, we have fully vaccinated 162 million Americans, including 80% of those most vulnerable, individuals 65 years and older. As a result, we have fundamentally changed the course of this pandemic. The threat is now predominantly only to the unvaccinated. The data is clear. The case increases are concentrated in communities with low vaccination rates. In fact, the counties with the highest case rates have significantly lower vaccination rates than counties with lower case rates. This week, just 3 states, Florida, Texas, and Missouri, 3 states with lower vaccination rates, accounted for 40% of all cases nationwide. For the second week in a row, 1 in 5 of all cases occurring in Florida alone. And within communities, these cases are primarily among unvaccinated people. The third reason we're in a different situation than earlier in the year is that we're continuing to make more progress by increasing the number of vaccinated Americans. Importantly, states with the highest case rates are actually seeing their vaccination rates go up. In fact, in the past week, the 5 states with the highest case rates, Arkansas, Florida, Louisiana, Nevada, had a higher rate of people getting newly vaccinated compared to the national average. This is a very positive trend. For the second week in a row, states with lower vaccination and higher case rates are seeing their vaccination rates grow faster than the national average. People in these states are feeling the impact of being unvaccinated and responding with action. And across the country in the past 10 days, more than 5.2 million Americans have gotten a shot. So each day, hundreds of thousands of Americans are choosing to protect themselves, their kids, and their neighbors by getting their first shot. And just as importantly, hundreds of thousands more are getting their second shot on the way to being fully vaccinated. These Americans are stepping up and doing their part. Each shot matters. Each additional person fully vaccinated is a step closer to putting this pandemic behind us. So we're making continued progress in our fight against the virus. And today we're announcing additional resources to get more shots in arms and combat surges, particularly in rural communities. As the President said last night, unvaccinated Americans know and trust people in their own communities to help get them accurate information about vaccines and help answer their questions. Today, we are announcing that we are sending $100 million to rural health clinics to support vaccine education and outreach efforts in these communities where we are generally seeing low vaccine uptake. This funding, made possible by the American Rescue Plan, will provide nearly 2,000 rural health clinics the resources they need to better reach unvaccinated Americans in their communities with information about COVID-19 and the vaccines and answer to their questions. As we work to get more shots in arms, we're also doubling down on our efforts to detect, prevent, and respond to outbreaks caused by the Delta variant. Testing and building testing capacity is a key part of our surge response because we know quickly detecting cases allows us to help prevent outbreaks and contain the virus. Last week, we announced $400 million in American Rescue Plan funding for 1,540 small rural hospitals for COVID-19 to increase testing capacity in rural America. And today, as part of our efforts to reach more vulnerable individuals, we're making an additional $1.6 billion investment in American Rescue Plan funding to bolster testing and mitigation measures in high-risk congregate settings, including homeless shelters, mental health and substance abuse treatment centers, domestic violence shelters, and prison systems. These resources will help local health officials and communities identify potential outbreaks before they happen and prevent the further spread of COVID-19. Our COVID-19 surge response teams are also working with governors and local public health officials to identify specific needs on the ground and provide federal resources and support to fight outbreaks due to the spread of the Delta variant. We are now providing CDC's technical expertise, including on genetic sequencing, data analysis, and outbreak response, to Missouri, Illinois, and Colorado. FEMA will be deploying mobile vaccination clinics in North Carolina. And today, HHS Secretary Becerra is traveling to Nevada, where we have deployed federal resources and 100 personnel from FEMA and HHS to support local health officials as they work to mitigate the spread of Delta and increase vaccinations. In closing, our whole of government response continues to do everything we can to get more Americans fully vaccinated and protected from the virus and help states and communities curb the spread of the Delta variant. As the President said last night, it's up to each and every single American to do their own part. We know everyone's vaccination journey is different. We are ready to get more Americans vaccinated whenever, wherever they're ready. So please, if you are unvaccinated, consider vaccination today. It's free, it's available, it's easy, it works, and it's never, never been more important. With that, I'll turn it over to Dr. Murphy.
Well, thank you so much, Jeff. And it's great to be with all of you again today. I'll start just by acknowledging the obvious, what we're all seeing in the numbers, that it is troubling to see this rise in COVID cases. And it's another reminder that we're not out of the woods yet. But it's important also that we not lose sight of how far we've come. Cases are down dramatically from their January peak, when we were averaging 200,000 plus cases a day. We've gotten more than 161 million people fully vaccinated, which means they have a high degree of protection against COVID-19. And every day, hundreds of thousands of people are still choosing to get vaccinated. That is all good news. One fact that has been proven time and time again during this past year is that vaccines save lives. That's why 99.5% of COVID-19 deaths and 97% of hospitalizations are among the unvaccinated. It's also why nearly every death from COVID-19 is a preventable tragedy. I'd like to share a few updates about how we're continuing to support people in making their decisions about the vaccine. First, we are ramping up our work with trusted messengers in key communities. This summer, we've seen people in every community stepping up to get their loved ones and neighbors vaccinated. That's been really encouraging. And these groups include faith communities from the group Choose Healthy Life, which has worked with powerful networks of 48 Black churches in 5 cities to test and vaccinate people. It also includes the American Muslim and Multi-Faith Women's Empowerment Council, which has engaged their communities through phone banking, text banking, social media, and door-to-door canvassing. Healthcare professionals have also been stepping up, have more conversations with their patients. And earlier this summer, the Alpha chapter of the Chi Eta Phi sorority, a service organization made up of nurses, had more than 1,145 conversations about vaccinations at barbershops, grocery stores, and throughout their communities. We're also continuing to work with the Student COVID-19 Community Corps, where students participate in calls to learn best practices and hear from their peers about how they can talk about vaccines with their friends and family and community members. And we're working with platforms like Twitch to answer user questions about the vaccines. But very importantly, we're also increasingly asking vaccinated people to help get their family friends vaccinated. And the importance of this last item, family and friends, talking to family and friends, is underscored by recent data, which found that 1 out of 5 adults who were unsure family, friends, and their